Hey everyone, Dr. Mike here. Today I want to talk about something that impacts lots of kids and families, especially during the winter months, and that is eczema. If your child has dry, red, itchy skin that just won't go away, you're not alone. Eczema is super common in kids, and while it can be frustrating, the good news is there is a lot we can do to help. So let's break it down. First, what exactly is eczema? Well, it is a skin condition that causes dryness, itching, redness, and sometimes even cracking or oozing. It's not contagious, but it is persistent and it tends to flare up from time to time. So, what causes this? Well, eczema happens when the skin barrier is not working quite right. Instead of keeping moisture in and irritants out, the skin loses water and allows surface chemicals in, which triggers the immune system, which causes inflammation, which further disrupts the skin barrier. So, as you can see, it quickly becomes a vicious cycle. Common irritants that can result in an eczema flare include soaps, shampoos and detergents, fabric softeners and dryer sheets, fragrances, certain fabrics, dyes. Pretty much anything that touches the skin has the potential to make things worse. Dry air makes it easier for water to leave the skin through evaporation, which is why eczema is often worse in cool, dry seasons, like winter. Allergens, including pollen and pet dander, can also make eczema worse, as can stress, because stress hormones act upon the immune system. For many kids, eczema and related conditions like asthma and seasonal allergies tend to run in families. So if you or your child's other parent have any of these problems, there's a higher chance your little one will too. So there's a lot at play here, but the big question is, how do we treat eczema? Well, the key to managing it is keeping the skin hydrated and avoiding triggers. Here's what works best. First, moisturize, moisturize, moisturize. And I could say it a few more times. Lotion is good, thick creams are better, and ointments like petroleum jelly, they're the best at sealing the skin barrier and locking in moisture. Although they are pretty greasy and can get on clothes, and your child might not like their look or feel. So use what makes the most sense to your kiddo. Apply these products at least twice a day, especially right after a bath when the skin is still damp. Speaking of baths, you want to take short, lukewarm baths. Hot water dries the skin out, so keep bathing time short and use warm water instead of hot. After bathing, pat the skin dry, don't rub, and then apply that barrier cream. Otherwise, the bath water will evaporate, taking skin water with it, leaving your child even drier than they were before the bath. And then stop the itch. Scratching makes eczema worse and can lead to infections. So trim those nails short, use cotton gloves at night if needed, and if the itching is really bad, talk to your child's doctor about medications that can help. Finally, know when to see a doctor. If your child's eczema is not improving with home care, if it looks infected or keeps them up at night, then it's time to check in with your pediatrician. Sometimes prescription creams, such as steroids or other treatments, are needed. Treating eczema is important, but how can we prevent these flares in the first place? Well, there are several things you can do, and I think now that we know what causes eczema, these will make some sense. First, keep the skin moisturized daily. Sleep with a humidifier in the bedroom, especially in those dry winter months, and avoid known triggers like harsh soaps or allergens. Bathing is okay, even daily, but keep the bath short and the water warm, but not too hot. Then pat the skin dry and immediately apply a barrier cream to keep the water in the skin. Dress in soft, breathable fabrics like cotton, and manage stress, since we know this can make eczema worse. Consistency in following these steps is key because a good skincare routine can make a huge difference. Eczema can be frustrating, but you're not alone in this, and with the right care, most kids do really well. Thanks again for stopping by. If you have a comment or a topic you would like me to cover, please drop that below. And if you found this information helpful, please like this video and subscribe for more child health tips. These things really do help the channel. I also host a podcast which has been in production for nearly 20 years now. It's called PediaCast, and you can find it wherever you get your podcasts. Until next time, this is Dr. Mike saying have a safe and healthy day. I'll see you again soon.